Since the pandemic began, we've been bringing you stories of survival, sharing the moments patients hospitalized for COVID-19 get to finally head home. But the battle for many of those patients does not end when they leave the hospital. RTV6's Cornelius Hawker shows you what a doctor and a survivor say about the mental toll of fighting off serious COVID-19 cases.
Dr. Barbara Khan runs the Critical Care Recovery Center at Eskenazi Health Services. The center helps ICU survivors suffering physical and mental issues.
Now the patients are in isolation. Family is not allowed to visit. They cannot see their loved ones.
He says the scenario faced by COVID-19 survivors sets them up for potential problems once they leave the hospital setting.
Because of being exposed to extreme stress, they can develop symptoms of anxiety, depression, post-traumatic stress disorders.
The issues people face after battling a critical illness like COVID-19 is called post-intensive care syndrome. Demarie Williams, who was in the hospital for COVID-19, has some of the symptoms Dr. Khan mentioned.
I now have anxiety attacks, and now they're looking into it as PTSD. There's some nightmares going on. There's some other mental stuff that goes on.
Williams's fight with the virus began toward the end of March. Things got so bad at one point, the doctor told him to start getting his affairs in order.
Right after he told me, we planned my funeral right after that. When I first got out, I still had hallucinations for about 5 days. I fight on a daily basis, but for the most part, it's being controlled. I'm not on medication or anything like that. Just have to work through it each day.
His doctor is working with him on a treatment plan so he can get back to cutting hair once barbershops are allowed to reopen.
Holding clippers will be different at first, and I'll get back into it because that's what I do, but it's just the confidence of just doing it and making sure it's still at a high level.
Dr. Khan hopes doctors treating patients who've recovered from COVID-19 will start asking questions and working on treatment plans that will help them regain a sense of normalcy.
Acknowledging it and connecting with them and tell them that, okay, I may not have gone through this, but I can understand somewhat that you're going through, and we have the resources and we can pull it together.
Working for you, Cornelius Hawker, WRTV.